Hello, good afternoon everyone. Today we are going to have a video testimonial of one of our patients who have come here overseas to have an elective surgery. So I would like to introduce you to Mr. Damien Neale. Hi Damien, how are you?
Go on.
Okay, my first question is, why did you choose to have your surgery overseas instead of doing it in Australia?
Well, basically all the Australian back doctors said, well that's your lot in life, son, we can't do much for you, so send the same scans over to here, and they said we can fix you, so here I am.
Alright. Were you in pain?
Yes.
How long were you in pain?
8 to 10 years, getting worse.
Wow, that was a long time. So how did you find global health travel and your overall impression during your first contact?
Yeah, no, it was all good, no complaints whatsoever, so yeah, everything went well, so.
Alright, how long did it take you before you were able to get an appointment here in Thailand?
That was only about 3 or 4 weeks from when we initially said yes, let's do the procedure to here I am.
Wow, 4 weeks. That's quite quick. Were you nervous before coming over here?
Yeah, it's like any surgery, if you're not nervous, yeah, be concerned.
Yeah, that's quite normal. So what did your family think about doing your surgery overseas?
No, it was all for it, because the Australian doctors couldn't do nothing, so.
All good. So what was your first impression of the hospital?
Yeah, no, it's very flash, very organised, everyone's friendly, so no complaints.
Who was your doctor?
Dr. KV, don't ask me to say his name.
I know, it's Dr. Verapan. So how did you feel after walking out of that consultation room and after seeing Dr. Verapan?
Yeah, quite confident after the first one, but instead of coming across for just initial lower back surgery, got 3 fusions in the neck as well, so yeah, so it cost a little bit more, but feeling better.
After your consult, what was your clinical diagnosis?
Just spinal and neck fusion.
Okay, was it any different with what was diagnosed to you before coming over here in Thailand?
Yeah, it was only the back fusion was the initial one, but yeah, got 3 fusions in the neck as well, so.
Alright. So when did you have your procedure done?
What was it, the 18th? Flew in on the 17th, the 18th I got the neck one done, and lower back was done on the 23rd, so now it's the 31st, so all good, going home tomorrow.
So what are the series of tests that needs to be performed before you were cleared for surgery?
It's just normal routine, blood tests, heart sort of tests, body, cardio and all that sort of stuff, x-rays, bits and pieces, so nothing too out of ordinary.
Alright, so what procedure did you undergo?
Fusion of the neck and fusion of the spine.
Okay, so what was the prognosis after the surgery?
It hurt.
Does it still hurt now?
Nah, it's getting better and better. So next bit.
Alright. So how did you feel when you woke up after the surgery?
Ow.
Ow.
That's like anything. So they do surgery, it's going to hurt a bit, but it's getting better and better day by day. So.
Alright. Well, as what you just told me, I think your pain was alleviated after the surgery.
Yes.
Alright. So how much did the procedure cost in total?
I think it was about 1.2 million baht. So.
Alright. So the big question is, would you recommend other Australians who are on a long waiting list or suffering in pain like you did before to travel overseas and jump the queue to have elective surgery here in Thailand?
Yeah, no, if they can afford it, and yeah, definitely gets the job done quicker and easier. Everyone's nice over here, so.
Alright. Well, there are lots of Australians in a similar situation who are in a long waiting list and who thinks you are probably crazy traveling to Thailand for a spinal surgery. So do you have anything you would like to say to them?
No, it just depends on how long they want to put up with the pain and sort of dealing with the government system, and get over here, get it done quicker, get pain free. That's the main one.
Alright. Do you have any tips or suggestions for these people?
Nah, just go. If you want to get it done, get it done.
Okay, but lastly, how did you find the pre-operative and post-operative care and the assistance provided by Global Health Travel?
Yeah, no, it was excellent. The girls and everything helped us out all the way through it, so from appointments to taking us to the different meetings and that, to the department, so yeah, thumbs up, all good.
Would you recommend global health travel to friends and family?
Yes, I certainly would.
Well, thank you so much, Damien, for giving this opportunity, to be interviewed and, to share your experience to other people. We are so glad that we are able to help you, and hopefully we can help more Australians in a similar situation. Tomorrow you'll be flying home. So, in behalf of all, the team of Global Health Travel, we wish you a speedy recovery. And hopefully, you'll be able to walk pain-free in the next couple of months.
Should be able to be running a marathon, I reckon, in about 3 months, so should be all good. Thank you very much.
Alright, thank you so much, Damien.
No worries, thank you all very much.